it take a patient to get better under cervical care is a very tricky question because it really depends on multitudes of different factors. You know, how old the patient is once they come into an office, how long the problem's been there, what degree of damage we see on an x-ray. So really it encompasses many different factors. So we can see people get immediate symptomatic relief or problem relief right after a correction, and sometimes it might take months or years to the body to completely resolve itself of a health condition. And it also depends on what your lifestyle factors are like. Maybe, you know, if you're a smoker, or if you have any kind of emotional stress or physical stress, maybe you have a demanding job. So a lot of those factors take into play, and really when it comes down to is that you have to know what it takes in all aspects of your life to regain health.
25% of the patients we adjust within the first week, they have what I call the wow experience. Wow. If I'd known about this 20 years ago, I would have been here 20 years ago. The other percentage of patients, they slowly start to come out of their problems. And that makes sense. If you've been suffering, had tissue damage and inflammation and ligament damage and all sorts of problems, it's not gonna happen overnight.
But it took 5 years to completely correct that neurological situation. I've seen many younger patients and patients who have not had those problems as significantly as she has heal up much faster.
Now, for instance, for a small child that's only had a misalignment a few days or a few weeks or a couple years, obviously can recover quicker than someone that's had a misalignment for 30 or 40 years.
How long you've had your subluxation plays a major role. If you were dropped on the floor or fell off the changing table at age 1, and came in to see me at age 30, 30-year-old patient's pretty young, but they have a 29-year-old subluxation. And the problem that they're going to have is their muscles will have amnesia. They've lost their memory. So they do not know how to pull themselves back in place. So you might think the number one objective I have is to get rid of your pain and get rid of your symptoms. And fortunately with upper cervical, that's usually the first thing to go away. But what I'm really concerned about is getting the memory back in those muscles and ligaments so that they can start pulling the segment back in on their own. I don't want to follow you around the rest of your life when you go to Yosemite, well, maybe when you go to Yosemite, Hawaii. But what I'd rather do is have that spine regain its memory it's supposed to have and learn how to fix itself.